I think that we're in really dangerous territory when we give people the impression that depression is caused by a chemical imbalance or a brain disease of some kind, because it keeps people from doing a different kind of searching. People stop looking for a better answer when that's the answer that they get and that's the answer that they believe. People can be depressed for lots of reasons. People can be depressed because of something that happened in their childhoods that is continuing to gnaw at them. I think especially when we're given the message that depression is caused by a chemical imbalance, we're that much more apt to dismiss those kinds of early childhood experiences as the thing that could be generating our distress. They might not go to therapy because they just think they have a brain disease. People are less apt to do that if they're told that the problem is inside of them and that the problem is wrong, something that's wrong with their brain.
So hi, I'm Dr. Josef Witt-Doerring. It is my pleasure to be joined with Dr. Leslie Carr today. She is a clinical psychologist, speaker, and expert in how trauma, stress, and culture and digital technology impact the mind. She hosts the beautifully produced and very engaging podcast, The Nature of Nurture, which I love. Links to this will be below, where she talks about all of these issues. Dr. Leslie, what did I miss?
Oh, man, nothing major. Thank you very much for your compliments on the podcast. That means a lot to me.
I'm really going to lean on Dr. Leslie's expertise. And I think this whole episode is really going to be talking about the role of therapy and, where do people turn when medications don't help them. And so I think a fun way to actually start this, and something I was talking to Dr. Leslie about before we started this, was actually to look at an old Zoloft commercial, which kind of talks about depression. So I'm gonna pull that up so we can just have a watch of it and then react to it. So let's do that.
You know when you feel the weight of sadness. You may feel exhausted, hopeless, and anxious. Whatever you do, you feel lonely and don't enjoy the things you once loved. Things just don't feel like they used to. These are some symptoms of depression, a serious medical condition affecting over 20 million Americans. While the cause is unknown, depression may be related to an imbalance of natural chemicals between nerve cells in the brain. Prescription Zoloft works to correct this imbalance. You just shouldn't have to feel this way anymore. Only your doctor can diagnose depression. Zoloft is not for everyone. People taking MAOIs or Pimozide shouldn't take Zoloft. Side effects may include dry mouth, insomnia, sexual side effects, diarrhea, nausea, and sleepiness. Zoloft is not habit-forming. Talk to your doctor about Zoloft, the #1 prescribed brand of its kind. Zoloft. When you know more about what's wrong, you can help make it right.
Wow. Okay. That aged poorly, so for me. Oh.
Yes, that's one way to put it. Yeah.
There's so much in there. And I think, I was just on Dr. Leslie's show, and I watch a lot of her podcasts, and she talks, very critically about how society has been kind of led to think about depression and the cause, and maybe how it leads people down, the wrong path, looking for answers. And I think, that's why I thought of this commercial would be a great place to start. Dr. Leslie, your reaction to that.
Oh man, there is a little bit of a feeling of where to even begin. There were a couple of things that jumped out at me with that ad. Where do we start, right? And one of them is just, there's this little caveat in the ad that you could easily miss if maybe it's the first time you've ever listened to an ad like that, where it says, the causes of depression are unknown, but they may be a result of, this thing called the chemical imbalance. And those little caveats are actually a really big part of how those ads were ever able to get created in the first place. You have to sort of bracket it. The United States is one of the only countries in the world that can do this direct to consumer advertising. And part of how the pharmaceutical companies got away with making ads like that is with these kind of little, depression may be caused by a chemical imbalance. We don't really know, but here's the drug, And one of the other things that really jumped out at me is this whole idea of only your doctor can diagnose depression, which is, this is a sort of a 7-layer cake of problematic stuff here. But first of all, no one is more the expert on you than you. But the notion, your doctor implies to people that it's actually their primary care physician that ought to be diagnosing their depression, which is inherently super problematic. So I don't know, I'll pause so that I don't get too much on my soapbox, but
I want you on the soapbox. That's why I brought you on here, because talk to us why something that sounds innocuous like that, talk to your doctor about depression. If you're feeling blue, go and speak to him. How can something like that end up being dangerous for people?
Yeah, it's a really good question, and it's multifaceted. So it was the case for a long time when I didn't fully understand how destructive antidepressant medication can be, that I actually just thought it wasn't so much that the prescription in itself was, so damaging or so problematic, but it just was the message that it gave people that if they were struggling in some way, that something was wrong with their brain. Now, I've come to realize the situation is far more complicated than what I originally thought, but I think that we're in really dangerous territory when we give people the impression that depression is caused by a chemical imbalance or a brain disease of some kind, because it keeps people from doing a different kind of searching. People stop looking for a better answer when that's the answer that they get and that's the answer that they believe. And to sort of zoom out for a moment here to try to explain myself a little further, I think that people can be depressed for lots of reasons. People can be depressed because of something that happened in their childhoods that is continuing to gnaw at them. They might not even really consciously remember what that thing is. I think especially when we're given the message that depression is caused by a chemical imbalance, we're that much more apt to dismiss those kinds of early childhood experiences as the thing that could be generating our distress. But there also are a lot of things that can happen in our adult lives that make us depressed. The economic circumstances of most Americans is pretty harrowing. That is enough of a reason to feel depressed. So what happens is that I think when people are led to believe that their depression is biochemical, they stop looking for different and I think better solutions to their problems. They might not go to therapy because they just think they have a brain disease. They might not. So for example, loneliness is a huge generator of depression for a lot of people. A really solid antidote to feeling depressed is kind of connecting in your relationships. And if you don't have them, going out and finding some. People are less apt to do that if they're told that the problem is inside of them and that the problem is wrong, something that's wrong with their brain.
I'm really excited to have you weigh in on this because I want a psychologist's perspective on this. There's something about being told that your problems are due to a chemical imbalance that I think can be appealing to people for different ways. Sometimes it's maybe an easier explanation. It's a less, trying to think of the right word, like maybe less offensive or something like that. That's probably not the right way of saying it.
The idea that it's not your fault, right?
Yeah, that it's not your fault, it's not your family's fault, and that, and I would just like your whole download on how something like that can actually, people can cling to that and maybe actually even get quite upset if it's challenged.
It's such a good question, and I have so much to say about this. So I think there's, in my mind, two primary things that load into this. One is on an individual's level, it may be comforting to hear that your depression or any amount of kind of psychic distress that you're experiencing, that it's biological in nature, because it makes the solution a little simpler, right? In the United States, for example, there's a big culture of people just wanting to take a pill. It's easier than quote unquote doing the work. And we'll get into what I mean by that a little later. But I think for some people, it's easier, quite literally easier in the sense that it takes less effort. But there's this bigger, broader issue of stigma. And this is something that I have thought about for a very long time now, because my entire career has been arguably, in my mind, devoted to decreasing stigma in mental health. And I think that there are a lot of well-intentioned people that believe that part of how you destigmatize mental health issues is by putting them kind of on par with physical distress. And it's, the very word parity is something that is big, even in terms of trying to get insurance to cover mental health issues, right? We want to think that these two things are comparable. And I think that they are comparable in the sense that our mental health is just as important as our physical health. The brain is the most complex organ in the body. It needs to be covered in every way that it can be. But some really interesting studies have been done around whether it actually works to decrease stigma for the general public to believe that our mental health experiences are a result of biology. And interestingly, there's this sort of irony around this where it doesn't actually work to decrease stigma.
Have you ever had experiences where someone was actually maybe, I don't know, quite defensive if you challenge them in your one-on-one work about it, where you try and kind of, go deeper? Maybe not. Maybe people are coming to you because they're especially looking for more psychological explanations, where they're just, maybe shut down about it and they just go, no, it doesn't seem to be coming from anywhere. This is just the way I am and the way my family is. Have you ever run into that on a one-on-one basis?
I've never experienced anyone that was super defensive or protective about it. And there might be a self-selecting issue there. But I have experienced instances where it's just taken a little bit of work and a little bit of doing to help someone to see that, in fact, something else is happening. I have had people come to me where it could just be the very first session. And as they're telling me about themselves, one of the things that comes up is that maybe they already take an antidepressant or something like that. And they might say, I sort of struggle with depression, and they'll say something that sort of suggests that it's inborn or biological. And I am very gentle in my approach at a time like this because I'm not interested in being right for the sake of being right. But I do feel like a really big part of my job is to help people to see how that is not the whole truth of their experience. I've never, and I actually really truly believe, I can say this in all honesty, I've never not been successful in that regard, because I think that part of the point of being in therapy is that once you start to actually connect dots and help someone to see how their lived experience is contributing to their felt sense of what it means to be alive, really quickly people start to come around. And it's like, oh, there's something else has been happening this whole time. So I've never experienced, a sort of a staunch defensiveness. I have, on the contrary, had several people show up in my office very upset because the doctors, clinicians, mostly medical doctors, their general primary care physician, that kind of thing, has already given them the impression that they think they have a chemical imbalance. A lot of times people will come to me after their doctor has already prescribed an antidepressant, and they're really upset about it because they can sort of feel it in their bones that their feelings, that everything is a response to something that they've lived through. So that to me is an example of where I think a lot of primary care physicians and general practitioners can be really misled in writing prescriptions for antidepressants without any kind of referral to mental health follow-up care, not starting with something else like therapy. Some people are really upset about it.
Yeah. And I know you've spoken about this, about how, the primary care office is probably just about the worst place that you could go to get if you wanted a comprehensive understanding for why you're sad. One, they don't have the training to do it. Two, maybe you get 10 minutes of FaceTime there. And so, given all of that, I'm going to segue now, and I'd like you just to give us, a big overview of depression and anxiety from your perch, from people who walk through the door and like, what are you seeing? Like, what are the major causes that are making people upset?
It's such a good question. And I definitely have to go, each thing is an individual case with, depression, anxiety. They are, even though they go together sometimes, they're such different experiences. So we'll start with depression for a moment. Going back to what I was saying before, there are lots of reasons why a person can struggle with depression, whether it's sort of a low grade kind of thing or even a major depression. One of the things that I want to draw everybody's attention to, and can be in some ways, I think, the hardest piece of this to talk about, is that a lot of times people are struggling with depression because of early childhood traumas that just kind of got absorbed into the life story, right? Like, I think we live in a world where people have a very complex understanding of, or sort of reaction to, the word trauma, because a lot of people think that it has to be a big, discrete, obvious trauma, like like someone going to war in order for something to qualify as trauma. I think that the human condition is inherently traumatizing. And for a lot of children, because there is literally no such thing as the perfect parent, doesn't exist, children can oftentimes experience certain things in their relationship with their caregivers as a form of trauma that can kind of become like death by a thousand cuts, like very mundane forms of neglect can be experienced to a developing mind as traumatic. So if we sort of stick with this example for a moment, and later I want to zoom out and get a bit societal, but if we sort of stick with this for a moment, it's interesting to think that people can grow up to feel like something is wrong that they can't put their finger on. And it's really easy to think that the origin must be biological, because part of the experience of being alive is to not know precisely what it is that ails us. The psyche is built to keep certain things from us, like certain uncomfortable truths. And some of those uncomfortable truths can even just be, let's say, like an anger that you have towards a parent that you also really love. I think something that I'll interrupt myself and say really quickly is that I think that one of the misunderstandings of any high quality therapy is that you're going to go in and like bash your parents, right? It's all these Freudian jokes of like, if it's not one thing, it's your mother, And meanwhile, I think that actually when we're really doing good work, we can also start to have a lot of compassion for our parents, because they also received imperfect parenting, and we're moving into the territory of what a clinician like me calls the intergenerational transmission of trauma, right? That this whole business of being human is not easy. It's not easy to parent. It's not easy to be parented. Like, we live in a world where nothing is perfect. So all these like tiny little things can go wrong.
I was wondering if there's any clinical stories that you could share, just of how, just vague outlines of things like this, how you might see them impact someone's, relationships, and just to give the audience a sense of how, things that you learn from your parents, or how they behave around you might turn up in maladaptive behaviors and things like that, just to kind of weave the trauma into present day depression and anxiety. Yeah.
So obviously being vague enough to be very mindful of protecting, identifying information. I can think of a young man that I've worked with for a long time now, who serves as a really good example to me of someone who, when he first came to me, was struggling with feeling depressed and had already been put on an antidepressant, was convinced the problem was biological. And at the time, this was several years ago now, he was in a very serious relationship with a woman that he lived with, and that I think, he loved very much in a lot of ways. The relationship was very close and very enmeshed, but it didn't take much doing before I started to realize that actually the relationship was pretty dysfunctional in a lot of ways. He wasn't being treated very well by his partner. And interestingly enough, the ways in which he wasn't being treated very well really mimicked some of the things that had happened in his early childhood with his parents. And to him, it wasn't rocket science that his home environment was not ideal, in the sense that I think he viewed his relationship with his parents as being pretty dysfunctional in a lot of ways. But nonetheless, he still thought the depression was sort of in his brain, I think because we live in a culture that makes people feel that way, right? So as we started, doing the work, and I was getting to know him and reflecting things back to him, I helped him to see a couple different things that made a huge difference in his life. One was that part of what his relationship with his parents included when he was young was a lot of what we can legitimately call emotional and psychological abuse. Like, they just had a way of speaking to him that really took a toll on his self-esteem. Like, the environment wasn't very warm. It wasn't very loving. And he was made to feel, I think, in a lot of ways growing up, like he had to be the one to kind of take care of everything for himself. The more complicated piece, in a way, and this can be a really painful part of sort of doing the work in therapy, was slowly but surely he started to realize that there were some things happening in his relationship with his partner that were sort of equally not ideal. She was sort of speaking to him in ways that weren't always kind. And there just were a lot of patterns in the relationship that I don't really want to elaborate on, that I think were really not healthy. But the thing that happened for him that was, it's amazing. I'm still working with this person, so it's amazing when we talk about this now. It took a lot of courage for him to realize that he needed to leave this relationship ultimately. But then he did. He's been now out of this relationship for at least a year. I'd say probably closer to 2 years. And he has these moments sometimes where every once in a while, he just feels the need to kind of like give himself a high five for the fact that he got out of this relationship that I think for a while he thought was good just because he loved her. And, I think there were a lot of reasons why he sort of thought the relationship was good enough. But it took getting out of it for him to sort of see, like, oh, no wonder. Can I curse on this podcast?
Yeah, go for it. Yeah.
What I was about to say is, like, no wonder I felt like shit. He just sort of felt like shit a lot of the time. And, he has some things he sort of continues to struggle with today, which is why we continue to work with each other and that kind of thing. But there is a night and day difference from the person that I see sitting in front of me these days, from the person that came into my office a couple years ago now, feeling like his depression must have been caused by a chemical imbalance, because why else would he feel so bad?
Yeah. I'm really glad you gave a story, because what I want people to hear when they listen to this is how complicated understanding why people can have depression and anxiety can be. Yeah, it could be a big discrete trauma, but it could also be, being kind of put down by your family, or maybe they're very emotionless and, very harsh. And then you take that on and you think that's normal. And then it plays out in your relationships later on that, everyone's so sensitive and they should just be a bit more thick skinned like you, because that's normal. And, how that ends up, affecting you in your career when you can't play nice from the sandbox, or how it affects you in your relationships, and just the different ways, what you grow up around can end up manifesting in your life, which you won't even realize, because it'll just seem, like water is for fish. It's just a part of who you are, and just feels innate. And so
it's well put.
Yeah. So I love that you brought that up. And so let's talk now a little bit about how do you help people? So we're going to juxtapose the two things, going in and seeing a doctor and being told you have a chemical imbalance, to what do you do when someone walks in the door and they're depressed? What does that whole process look like for for being like, hey, how can I help you? That whole thing.
It's such a good question. And it's so funny. I don't mean to say that every time you ask me a question, but you're asking me a lot of good questions. And there are some things that I can share with people that I think will be very helpful outside of the context of therapy. There are certain things that I think, some things that I've learned in the process of becoming and being a therapist that I think have a lot of outside of the therapy realm utility. So I'll try to make this really useful for people. But, in the very beginning, when I'm first working with somebody new, I really only have two jobs in my mind. One is to help them to feel as comfortable as I can, because I know the whole process of going to therapy can be very uncomfortable. Can be very scary for a lot of people. So it's always my intention to take as much of the fear out of it as I possibly can. And I get super curious because in my mind and in my experience, there are no two people on the face of this planet that have had the exact same experience. So even if I have two separate people coming into my office, not at the same time, but let's say back-to-back appointments, two people showing up saying that they feel quote unquote depressed. I want to know what they mean by that word, right? What does that word even mean to you? What are you actually feeling? Because the differences can be enormous. One person can be struggling getting out of bed in the morning, and another person can be having, maybe there's a lot of internal chatter, but a word that big can mean wildly different things to different people. So it's just my intention to get curious. But a lot of what I am looking to understand is that person at the level of their relationships, past and present, right? Like, what is the landscape of a person's relationships like now? Who are the key people in their lives? Who are the most important figures? Do they have close relationships? And just historically, how have they experienced being in a relationship with other people? So anything that they remember about what it was like to have their parents as parents when they were kids, did they have siblings? And if so, did they get along with their siblings? And a lot of what I am looking to understand as deeply as I can, and this is where, so I'm going to say something that, is very specific to therapy in the sense that you have to be really trained, I think, to do this. And then I'm going to give the thing that I think will be helpful for other people. But part of what I'm really looking to understand is what that person appears to believe to be true about themselves or about life or about how they exist in relationships that usually goes back to its origin story, right? So if I use an example for a moment, let's imagine that somebody is single or dating or in and out of romantic relationships, and it starts to become clear that they chronically have the feeling of being disappointed. They get disappointed over and over and over again. I want to know what their earliest experiences of being disappointed in relationship were. Like, the stuff never comes from nowhere. So that's the more, I'm not necessarily going to be able to impart to to a lot of people who are listening to this right now exactly how to do that work, because I went to school for forever and all of that stuff. But one of the things that I'm always aware of whenever I'm working with people is that the mere experience of being listened to, truly listened to by someone who is being curious about you is, for most people, it's a refreshing experience. And for a lot of people, it is so different than anything they've ever experienced before that it's like giving water to a very thirsty plant. I think that one of the things that makes life very hard for, I want to say almost everybody, like it's so pervasive that it's hard for a lot of people, is that we, generally speaking, live in a world where our collective EQ is pretty low. So people frequently have the experience of, looking for going to a friend, looking for advice, looking for help with something. And, they're given bad advice, or the person tells them to just get over it. Or before they're even done speaking, the other person is looking for their turn to talk. There's just, I think if I were to give maybe the best example that I could give from these days, because it's really pervasive and it's also disturbing. It's like the equivalent of going to somebody and looking for their ear, but like they're half on their phone half the time. They're not really listening to you. We live in a world where a lot of people are very bad listeners. So the mere act of being listened to and sort of being attended to in that way is in itself therapeutic. And I really don't say that lightly, because when you carry that experience through, like if a person keeps going to therapy and they keep having the experience of being listened to in this very deep, curious, non-judgmental way, they start to get what we call a corrective emotional experience. They start to feel themselves reflected in another in a whole new way, where they get to feel like their thoughts and feelings and experiences are interesting to someone. Or I'll pause here and let you kind of maybe jump in with a reflection or a follow-up question, but it can be so powerful.
Yeah. So I'm going to do a recap and then a follow-up question. So what I was thinking when you were talking about that was that there's really I'll say an exposure component, or like a practicing component to being in therapy, where maybe you're not a good listener, or maybe, you've never seen anything like that happening before. And that by, going through that, you learn those skills, and maybe you even might decide that you want someone, that has those things, or you might want to work with your spouse to do more of that. So there's this kind of, this practicing of doing that. Oh, this is how relationships work. Yeah. But the larger question that I wanted to ask was, I asked, how do you help people? You didn't start with like, well, I'll ask them what's upset, or, where they want to go. You went straight to relationships. You said, that, and so I thought that was telling. Why the focus on relationships? Why? Yeah, tell us about that. What is it about relationships that's like the thing that you zero in on when someone walks in the door and they're upset?
Well, now we're at my favorite question.
Yes.
So one of the things that I find myself thinking about again and again, noticing again and again in the work that I do, because it never ceases to amaze me, is that, human beings we are an unbelievably social species. We are arguably the most social species on the face of the planet. If I were working with starfish, I probably wouldn't really care about the quality of their relationships. But human beings are nothing without the relationships that exist in their lives. And a big part of that has to do with for how long we are dependent on our primary caregivers as children. It's really wild when you think about it, because in most of the animal kingdom, when animals give birth to their offspring, imagine if you've ever seen like a giraffe give birth, the baby giraffe comes out and just runs away, basically, Human beings are dependent on their caregivers far longer than any other animal is. And during that period of time, during our most formative years, which in my mind are the first 3 to 4 years of age, we are kind of learning everything from the people that we're in proximity to. So the word for this, there's a word, attachment, people think about a lot. I think actually an even more important word, almost arguably, is the word attunement, which is that, if you have ever, for anyone who's listening, if you've ever had an infant, played with an infant, you can sort of make faces at them. They make faces back at you and that kind of thing. As early as 40 minutes after birth, if you stick your tongue out at a newborn baby infant, they'll stick their tongue back out at you. because we are hyper wired to scan one another's faces for safety and belonging. And so much of the process of becoming who we are has to do with the way that people, namely our primary caregivers, but this is really anybody that's in our, what I'll call our social orbit, how those people treat us, respond to us. Human children, especially for the first 3 to 4 years of life, are sponges for all of the experiences that they're having. In the same way that we are learning to speak, learning to walk, we're learning what we can expect from other people and how they'll relate to us. So if I can maybe go a little bit deeper and just sort of give an example, when children learn that the key figures in their lives when they're young are safe, part of what it teaches them is that like the world is safe. But if you have a parent in your life, and this is sort of true for all of us on some level, it's pretty hard to escape, but we have ways of adapting to our caregivers because we have to, right? Like at a deep intrinsic level, children know that like their next meal basically is dependent upon these very powerful people approving of them. So a lot of what happens in these early days is stuff that is originally adaptive, even if later it becomes maladaptive, because we have to cope with the environments that we're in. Is all of this, maybe let me just feel free to steer me, but my brain gets really excited when I talk about this stuff.
No, you're doing great. And I guess the focusing question here would be, from things that come through your door and or maybe the doors of your colleagues out there, how much of it do you think boils down to relationships?
I would say almost all of it. And when I think about what doesn't fit into this category, I think we have to be aware as clinicians or as we're talking about this stuff about the role that a person's economic circumstances can play in things like stress and that kind of stuff, you know, in a hyper-capitalist country like the United States, where everybody really is left to fend for themselves in a lot of ways. There are adult stressors, and even just for children too. I'm sort of thinking about the notion of an ACE score, right? Like things related to poverty can be really impactful. And I think that there are a lot of other environmental factors like what we eat, exposure to toxins. You know, it's like, it's not all relationships, but relationships are most of it.
Yeah. And so I guess, I mean, it sounds like the work that you do is really complicated and it takes a long time. But is the goal eventually that they leave you? You know, they've learnt the skills, and you know they don't need the pills, and they don't need Dr. Leslie anymore, and they kind of
Hopefully.
move on, right?
Yeah.
So I'm going to ask you some questions to just get you to reflect on how your colleagues are doing, and I'm going to say this in a broader sense. You know, not just licensed psychotherapists, but you know the talk therapists out there. You know,
Sure.
all of them. How are we doing? You know, how are they doing right now in helping people with depression and anxiety from your perspective?
So fascinating, because if I zoom out and I think about the entire industry, for lack of a better word, I think a lot of it is really problematic. You know, I think that there are, you know, I just kind of can't help but think about the role that CBT plays in all of this, because just to kind of maybe make some things clear for people, I am not a cognitive behavioral therapist. I'm guessing that a lot of people have at least heard that phrase because it's really buzzy, right? And what a lot of people don't know about the notion of quote unquote cognitive behavioral therapy is that it is super duper well known, partially because it has been really well marketed oftentimes to people as the empirically validated form of therapy. A lot of that is just hogwash. They were the first, was the first type of therapy to submit itself to empirical validation. But apart from that, it doesn't have much of a leg to stand on. And part of what's really problematic about it is that in a world with managed care and where we're looking for insurance reimbursements, I think a lot of people, when they go to get any kind of mental health treatment in the United States, if they try to go through their insurer and that kind of stuff, they're either going to get a prescription or they're going to get, a 12-session time-limited form of psychotherapy that is going to be probably a manualized CBT, or somebody's literally using a manual. And, it's really interesting. There are studies that show, and I believe this strongly to be true, that when CBT helps people, something like 90% of the efficacy can just be attributed to like the kindness of the therapist, even when they're using a manual, right? That it's the number one kind of agent of change in any psychotherapy is the relationship between therapist and patient, so to speak, client. And so even in CBT, when CBT is working, what is actually working is the non-manualized elements of it. It's someone caring enough to ask you questions or trying to help. But one of the problems of CBT is that, and I don't mean to totally and completely bash it. I mean, there are some tools in that toolbox that I'll borrow from periodically, but in its essence, it's not super curious because it's just looking to kind of create behavioral change. Even if the behavior is the thought, which is a very weird thing, weird way of thinking about human behavior. But, there's technically thinking as a behavior, especially in the sort of cognitive behavioral world. And it's really, I think in that model, it often serves to make people feel wrong. We're looking to change thought distortions rather than to be curious about where those thoughts come from to begin with.
Tell me about the impact of that, maybe an example of changing a thought disturbance versus understanding it, how that could lead someone down two different paths.
Let me think about this for a second. It's so funny. It's been so long since I've had much exposure to the tools of CBT that it might be hard for me to think off the top of my head of what they would do. Like what would a CBT therapist do in the face of something, but yeah.
Well, if you can't think of, I'll give you a moment to think about it. But if nothing comes to mind, I'll ask you some follow-up questions. Yeah.
Let's maybe go for something else.
Yeah. Okay.
I'm like, pass next, please.
Yeah. No worries. Yeah. One of the things that I worry about with CBT, and again, I've done limited CBT in my training, is I don't know. I with something that's short like that, I also walked away with the impression that it was just like, change how you feel about your anxiety. Okay, you're having anxious thoughts. We'll learn some techniques so you can kind of soothe those anxious thoughts rather than maybe it being more directed at the causes. Okay, so why do you have anxious thoughts? What's going on? Something more like deeper. A lot of people could have anxious thoughts because they're in terrible relationships, or they're feeling like the job that they're doing at the moment is not really at the level where they would be happy. And I guess the impression I got with CBT, and this may be wrong, was that it doesn't really go deep like that into some of these more complicated things. It's like, oh, this is how we're gonna, just talk away the anxiety or something like that. I don't know. Is that?
Yeah, I agree. I would say that it's not very deep. It's not very curious, and it has a way of making people's thoughts and feelings wrong, as opposed to trying to understand them in context. And I think what I'll add here, just in case there are other what I'm always aware of at a time like this is that there could be a CBT-oriented therapist out there listening to this that wants to pick a fight with me. So I will just go one step further and say, I think the thing that feels most true to me about this stuff is that what the studies show is that you can experience some degree of progress after, let's say, 12 sessions, but that the gains don't last. When you do long-term follow-up studies with CBT, what you see is that people tend to kind of revert to the mean, or if they're anxious about one thing and you make some headway on that, next thing you know, a year later, they're anxious about something else. And I do think that, we live in a world where not everybody is going to be able to experience a deep exploratory form of psychotherapy. It can be cost prohibitive for a lot of people. I understand why insurance companies don't want to pay for it. But if we were to talk about cost-effective models, something that I think can be extremely effective and is often underutilized is group therapy. Group therapy, because of what I was saying before about the power of relationships, a lot of the benefit that people get from a one-on-one therapist in that deeper form of therapy, people can get from a small group of people when they're, let's say eight people and a facilitator or something like that. It's a model. I'm not here to sing Kaiser's praises because I think there's a big Kaiser has a lot of problems, but I did my predoctoral residency at a Kaiser hospital. And I think one of its strengths is that they rely heavily on the model of group psychotherapy. And it's a more cost-effective way to bring what can be a really high quality form of therapy to more people.
Cost effective, it makes me feel, I think about, the rates of mental health in the US and how they go higher. And there seems to be more and more scripts every single year. And it's like, the most cost effective thing is actually figuring out what the root causes of the problem, whether that's some kind of maladaptive traits that they've developed from childhood trauma or there's some poverty going on and we need to help in whatever ways we can, or maybe it's a dietary issue as well. And so it's, if you can address the root cause, that should probably be cheaper for the insurance company in the long run, because if you're just running someone through, CBT sessions and, higher and higher doses of medications without kind of fixing things, then it's very costly. And I guess I worry about that, with the DSM coming in and just being like, okay, 5 out of 9 symptoms, you have depression, that we've moved away from being professionals that focus on root causes. Why, what is the part that's not really serving them? And so, that's the thing that bothers me a little bit about CBT. I feel like maybe it's not, like you said, curious as to really getting at the root causes and maybe being more flexible. I don't think all problems can be just solved with, what's in the CBT toolkit. There's a lot of other solutions to things.
Yeah, I absolutely agree with you. And I think the one thing that I would say, to push back a tiny, tiny bit,
Please.
But I think it's good news for everybody involved, is that I think that getting to the root cause of things is always the best thing if you can do it. But there is a way that people can experience sort of here and now healing that doesn't always necessarily get to the root cause. The phrase that I used before is the notion of a corrective emotional experience. So for example, if a person had a parent that was untrustworthy, one of the ways that person, and let's say, for example, that created a certain, almost a form of like agita, not really knowing whether you can trust people in general, right? Because you had this untrustworthy parent. One of the ways that you can heal a wound like that is by having a reparative relationship with another person that is trustworthy. And one of the things that's really funny about this is that you can have a healing, curative experience like that and technically never know that the original problem you were looking to solve was having had this untrustworthy experience to begin with, right? And I think one of the things that's really beautiful about this is that human beings do this to each other all the time without realizing what they're doing, right? We can have curative relational experiences with the people in our lives that are not clinicians. And I think therapy is great. I think everybody should go. But one of the reasons why I'm saying this right now is because I think that people can have really healing experiences in a group therapy context. They don't even necessarily need to know what's being healed. But if their experiences prior were, let's say they have a really negative self-concept from previous life experiences, they just feel like people don't like them, no one ever listens to them, no one cares what they have to say. And then they go into a well-led group therapy experience, and the other members of the group treat them with curiosity and interest and care what they have to say. They will emerge whenever they're done with that group therapy experience, having experienced something very healing, even if they never actually knew what it was that was wrong to begin with. Well, yeah, well put. I love groups. I did a group in residency, and I thought that was a really interesting experience. I'm going to segue to another topic of discussion, which is you've been outspoken about not thinking that antidepressants are all that, and might be quite detrimental. You're quite unique in that respect. I don't think I know many therapists. I mean, I know some out there who have written books and things like that, but it's definitely not mainstream. What's going on there? Why isn't there more talk among our talk therapy colleagues out there who I would always, I might suspect that they are more, upset with things like the DSM and how it's reducing people down to kind of these simplistic categories and, just, the focus on medication and not really, I guess, helping people in the way that I would think that they deserve to be helped. But I don't feel like there's a lot of criticism of this very dominant medical model of depression and anxiety going on. What's the deal? I'd love your thoughts on that. I think it's really hard to say. I think it's possible that a couple different things are happening. One is that I think that there are a lot of therapists out there that believe what I believe, but they don't have a platform for getting that message out into the world. Like they might talk about this with their colleagues. Yeah, I have plenty of colleagues that I've spoken to over the years that believe the same thing that I believe, but they're not out in the world broadcasting it because they just don't have a platform to do that on. I think if there's anything that maybe makes me more unusual, the thing that really sort of sets me apart from some of my colleagues, and I think that this is, we could be asking you the same question, Josef, about like what fuels you and when and why you do what you do. But
mine's like a little different though, because we get fed the Kool-Aid. It's just like because in our work, like. You might even say like our livelihoods depend on believing it in a way, that, what we've been trained to do is the right way and the good way. And like, maybe we're even defensive a little bit because we've been, putting people on medications for, decades. But then I think about the therapist and I'm just like, a lot of the trade is understanding people and helping them. And then I'm like, so I guess maybe it could be, I'm like, why isn't it more, why aren't they saying like, hey, we don't agree with what you guys are doing to people because, we believe what we're doing is probably the better solution for people in the long run. We know about the dependence and the side effects and the overuse of these medications and how the family med doctors are just doling them out. We're seeing these people in our practice go through withdrawal and have complications. So I always was just like, But then at the same time, I've seen it before. I worked at a big academic institution. I've seen therapists and psychiatrists work side by side. There's also seems to be a big element of, playing nice in the sandbox, being a team player. It's like, you're not going to criticize your colleagues because, you're not going to be very popular. So I think there's a peer pressure element to it that I see, but I want your thoughts on that.
Yeah, I definitely have more that I have more that I can add here. And it's really interesting because I do wonder if there are some therapists that do have at least a little bit more of a platform, because Lord knows with social media and everything these days, there are far more people that are just out in the world saying what they think, that maybe don't bring up antidepressants because they don't want anyone to feel bad, or they don't want to make anyone wrong, or they maybe don't want to go up against the structures, sort of the powers that are bigger than them. There might be a little bit of a fear factor and that kind of thing. I really can't say. All I can say for myself, so I'll share something with you that I have never revealed publicly before, but I'm perfectly happy to do it right now. So I am a survivor of a very complicated childhood environment. And I'm going to be vague about certain details because it's not my intention to sort of throw anybody under the bus. But there was an experience that I had in my childhood that I would call emotionally abusive. And as a result of experiencing that emotional abuse, when I was effectively, displaying the symptoms of a kid that was, that had been emotionally abused, my father and my stepmother took me to a psychiatrist, and in 15 minutes, that person put me on Prozac. So I was on Prozac for 6 months when I was like 16 years old. And after taking it for somewhere between 3 and 6 months, but I've always remembered this as being about 6 months, I knew in my bones that I didn't have a chemical imbalance. I was just like, why is someone giving me a pill? I know what's happening in my house. And so I threw the prescription out, didn't bring it up with anyone. Interestingly enough, my father and my stepmother never followed up with me to make sure that I was taking the drugs. So I think once I decided for myself that I didn't want to take them and threw them out, it was sort of a non-issue. But I never forgot that experience, first of all, as something that was really harmful for me. There was a point in my life when someone took me to a clinician that could have been curious and asked questions and maybe could have advocated for me. And instead I was put on a drug. But the next thing that happened, not literally the very next thing, but the next major thing that happened in my life that was a total blessing was I went to college. And as I told you in our pre-interview from when I interviewed you for my podcast, one of my professors in grad school was Dr. Gary Greenberg, who's the author of books like Manufacturing Depression and the Book of Woe. And so I got to learn from him. And when I was getting a BA in psychology, he was my primary sort of academic, authority figure. And I learned a lot about sort of how bad the experience was that I had had. I think it helped contextualize things for me. And so on a private level, that is certainly a big piece of what fuels me. Yeah.
I think it's just so bad. It's like, your parents, dad and stepmom, obviously worried about you, don't know what to do, want to help you. They go, I better go take her to the doctor, like the Zoloft commercial says, or, take her to the professionals, they'll know what to do. And then instead of really making much of an effort to understand you, it's like, how can we sort of conveyor belt, young Leslie out of here, like pretty quickly, we'll just put her on the Prozac, see you in a couple months. It's so like not the care that anyone would want for their child, or anyone that they love. And we've normalized it.
Yeah, unless they wanted that kid to get with the program, right? I think that there's a certain amount of, I think that you are right in many, many ways. First of all, it's, I absolutely agree that the whole situation was super messed up, just super, super messed up. But I think that sometimes there is a desire to make a problem go away. And sometimes it seems like that's the easiest way to make a problem go away.
Yeah, that's like a whole nother element to it of just like, Leslie's a problem, you know. she needs the fixing, and nothing to see here.
Yeah, exactly.
And I bet that happens all over the place. I mean, I could see that happening in abusive relationships and all this kind of stuff. So, yeah. Okay, so I get that maybe that, like you said, is another element that drives you to be a bit more outspoken about it. So, segueing again now.
Sure.
For people out there who are coming off medications, maybe they've never had therapists before, or they've never done, talk therapy. They've just, seen doctors and gotten various medications. They're coming off now, but in many cases, the problems that led to them being on the meds are still there. Maybe they've developed some new ones just from compounding life problems. What should they do? Where do you start if you're interested in getting help in learning about, where depression and anxiety comes from and how to get help? How would you advise those people?
I got to think about that for a minute. It's a big one.
Mm-hmm.
First things first, I want to encourage people to just get really curious about themselves and to treat themselves with a lot of compassion and care. When we talk about the need for compassion in this world, a lot of that is compassion that we need to apply to ourselves. And when we're first engaging in what I would call a learning journey of trying to figure out sort of what is making us tick and how we're going to fix it, we need to get really curious, and we also just need to be really kind to ourselves. And I think everybody's journey ultimately is going to look different, which is a blessing and a curse. It's a good thing and a bad thing. I actually really want to encourage people to believe that they can forge their own path and take their own road, and that any one person's path to healing might not look like anybody else's does. So, couple thoughts just to sort of expound on this and explain what I mean. I am a really, really big believer in the idea of just learning as something that can orient us on our journey, meaning that I think that so much of what is required in order to heal any kind of mental health experience, any kind of mental health challenge, is learning about yourself. There has to be some degree of sort of personal growth and exploration, and something that we could call learning. So for whatever a person's, like, let's say you've been given a specific diagnosis, maybe even over and over again in your life. Let's imagine it's depression. Maybe you could go and read some books about how people heal from depression if you can't find high quality therapy where you are. I think that some degree of therapy should always be a part of this, but I think one of the things that I want to encourage people to look into is things like if funds are tight, if money is a concern, university counseling training centers, I think, do not get enough love as sort of a tool for healing and growth, because you'll be working with somebody who's learning, but that person is receiving supervision. I always want to be mindful when I'm having this kind of conversation that not everybody can afford, let's say, to go have a really high quality private practice therapy experience. But groups are an option. There's an organization out there called PACE. I think it's called PACE Group or something like that, where they do groups that you can join online. If people could check out the work of Dr. Nicole LaPera, the holistic psychologist, because she does a lot of things that, enable people to learn and grow on their own. She's got something called the self-healers group or something like that. Maybe let me know what you think and if you have follow-up questions, but I'm trying to think through, like, what would I do if I felt like I either couldn't afford kind of high quality private practice psychotherapy, or if for some reason I just didn't want to do that.
Mm-hmm. Yeah. The self-healers group, I think that sounded really interesting to me. As soon as you mentioned that, I was just like, that's a curious title. I'm going to go, track that down.
I think she's a good person to follow. I'll just sort of plug that really quickly as someone who thinks like you and I do, but has a really big platform. She's a nice voice to follow on Instagram. I just want to plug our colleagues that I think are doing good work.
Yeah. Okay. So you mentioned books, groups, and okay. So you talked broadly. What about for folks who do want to invest in it, and they're in a position where they could? Where should they be looking for help? And is it dependent on the problem that they're having? Like what problems might steer you in one direction or another, or like how do you Yeah.
I think sometimes yes, sometimes no. I think the notion of a therapist that, only does one thing, I think that some therapists advertise themselves as being experts in something because so many of us are taught that part of how you create a successful business is by standing out in one particular area. But I think that most good, high quality therapists are trained to work with people and not problems, right? Like it's, I always think about this when people ask me, like what kinds of patients I work with. It's like, as long as somebody is capable of talking about their feelings and connecting dots, it doesn't really matter what the presenting issue is. It could be anything. And I think that that's something that's just true of our mental health experiences in general, is that, even all of the stuff in the DSM, it's like largely made up. People vote on that stuff in closed door meetings. We've made these kind of fake buckets, to sort of put our problems into. I think most people are just struggling more generally than they are specifically. But yeah, I'm a really big believer in getting a high quality referral in any way that you can. So for example, if you know someone who goes to a therapist and they like that therapist, as long as it's not a super close relationship, as long as it's not, your spouse, perhaps you could talk to that person, talk to your friend and see if you can get that person's information. Here in California, we have a very specific kind of therapy matching service it's called COA, and the URL is joincoa.com. It was created by a colleague of mine named Emily Anhalt. That is, it actually helps to match people with their therapists. I think it only exists in California and maybe New York State. People can use something like Psychology Today. They should just know that the therapists are not vetted by Psychology Today, so you really have to use your own gut. And this is something that I believe really strongly is true no matter what. The only thing that really matters in terms of choosing a therapist is that you pick someone that you like, that, you should be able to have some kind of introductory phone call or meeting that enables you to get a sense of a person. Or let's say you go to one whole session, you just see how it feels. If you feel like that person is listening to you, expressing curiosity, treating you with respect, if you feel like you can imagine opening up to them, or you start opening up to them and you feel like that person is a trustworthy, empathic listener, that is going to bear more significant weight to me than whether you know somebody else that likes their therapist, because you could go to the same person and just not get the same vibe. There is a certain amount of choosing a therapist that's a little bit like dating. And I know that's kind of a crass metaphor to use, but it's all about what we call rightness of fit. That's the technical term for it. It's just like, do you jam with the person or not? Do you feel like they get you or not? And I really want to encourage people to trust their guts, because I think one of the things that's really broken about this entire system, whether it's going to a doctor and being put on an antidepressant, or, just this whole problem with what I would call the mental health industrial complex, is that people are not encouraged to trust themselves. We live in a world of kind of top-down authority figures, whether it's your parents or the government. People are often not, it's not recommended that people trust themselves. And I think that when it comes to sort of engaging in the journey of healing your own mental health, you have to learn how to get connected with your own gut so that you can trust it, because no one is ever going to be a higher authority on you than you.
What about like red flags? Is there anything that when people are looking for, they should be aware of?
Yes. If there's so many classic ones of like the therapist starts talking all about themselves, or they say something to you that makes you feel disrespected or sort of distinctly misunderstood. If they talk to you like they have all of the answers and you don't. I think a lot of it is honestly sort of a vibe and a gut level check.
Okay. Well, you've covered all of my questions. You've answered them really well, and I've loved the discussion. What haven't I brought up with you that you'd like to share with our audience, if anything?
I think it's possible that I can only think of one thing, but it's jumping straight to the top of my mind, so I'm going to say it. I think there is a force that exists in our culture right now that is very destructive, and it is our smartphones and tablets and devices. And the thing that makes it destructive is that people can sometimes be not super mindful of the impact that it's having on their human relationships in terms of how they use their devices. So, for example, people that give iPhones and tablets to their kids to sort of pacify and babysit their children, especially when those children are really young, has some really disturbing consequences to it. And just to paint a picture of the kind of thing that I'm talking about, because I'm not saying that a kid should like never look at a tablet, but there are a lot of people that I know will do things like give their kids, an iPad or something in a restaurant. Or I once saw a kid sort of at the hair salon with his head in the bowl with the looking up at the iPad. So while the person was washing his hair, he was like looking at a screen. And I think that a lot of people think, whatever is going to help my kid get through this moment is what we need most right now. And unfortunately, there's a lot of evidence to point to the idea that what I'm saying is true. We are starting to witness long-term consequences of children in those developing years not learning how to manage their boredom and frustration. There are certain mental muscles that get built when we are forced to feel bored for a little while, or forced to feel frustrated. When you're a little kid sitting at a restaurant and you're surrounded by adults and you're bored, you learn how to deal with your boredom. And we're seeing in a lot of today's kind of pre-teens, a lot of emotional dysregulation, because ever since those kids were toddlers, people were using devices to just sort of pacify and babysit them. So I want to make it clear that I'm talking about the more extreme edges of this. It's not, depending on how old a kid is and that kind of thing, it's not like there's no amount of digital technology that's acceptable. But going back to what I was saying before about attunement and relating and learning how you sort of exist in the world by the way that you relate to another person, I think there's a lot that's going wrong with technology. And one more example that I will use that is pretty heartbreaking is that a lot of women who breastfeed are also scrolling on their phones while they're breastfeeding because they're not finding it to be very stimulating. And that is extremely destructive to the developing mind of an infant or like early stage toddler. So that's my little PSA that I want to leave everybody with, is to really start paying attention to your relationships. And that includes your relationship with technology. We gotta limit that, please.
I love
PSA.
it. Dr. Leslie, where can people find you?
They can find me at lesliecarr.com or at Dr. Leslie Carr on Instagram. And they can find the podcast, The Nature of Nurture, in any podcast app. Or when we start releasing season 4, probably late February, they can find me on YouTube /at The Nature of Nurture. And if anybody gets lost, just come to lesliecarr.com.
Thank you so much for your time. It was a pleasure talking to you.
It was absolutely my pleasure talking to you. Thank you for having me.